Hickox describes her quarantine as disorganized and frightening. She details her experience in the Dallas Morning News. An official, quote, barked questions at me as if I was a criminal. Hickox says after disclosing she worked with Ebola patients in Sierra Leone, someone escorted her to a quarantine office at Newark Liberty International Airport. Hickox is now being kept in a tent outside a New Jersey hospital with nothing but her cell phone.
Chris Christie is used to being hammered over unpopular calls. Governors of major American states need thicker skin than most. His actions, along with those of fellow Governor Andrew Cuomo of New York, have lit a new Ebola firestorm, and the possibility of more interaction with law enforcement grows every single day. Let's welcome back to MidPoint former NYPD Commissioner and now CEO of the Kerik Group, and a true insider on intelligence and keeping America safe, Bernie Kerik. Bernie, it's a pleasure to see you again.
Thank you, sir.
Bernie, we need to point out that Governor Christie has, since we began the show and earlier today, basically decided that the young lady, Ms. Hickox, can go home, can spend her quarantine at home. But from a law enforcement side of things, when you start to look at this, stopping people as they come into the country, perhaps quarantining certain people, and the mere fact that something, and again, we're not trying to fan any sort of panic here, but it's reality, the mere possibility that something gets loose amongst the population, even New York City. What are law enforcement officials doing right now to get ready for the time when and if they need to become seriously day-to-day involved in helping to manage this?
Well, I think first and foremost, you have to keep things in perspective. And, this is one of those situations where you're damned if you do and you're damned if you don't. And I think Governor Cuomo and Governor Christie, they're going through that now. Personally, and this is me personally, I have no objection to the call they made for quarantine. Some people would agree, some wouldn't. The press and the media drives this interest, and quite often it drives panic. That panic can get out of hand, as we've seen on a number of other occasions. In this case, I think that's what the governors were trying to prevent, trying to lessen the panic to the public. Law enforcement is only going to get involved if there are cases where, the governor or a mayor, specifically, in bigger urban cities like New York City and LA or Houston or somewhere like that, law enforcement will go out and start to enforce some of these restrictions or quarantines if they have to, but I think that's really at a real last resort. I don't think they're going to get involved in stuff like this unless there's an epidemic and there's directive from either a governor or the president or a mayor in that case.
How fearful does that get, though, Bernie? Because, again, we're talking about something that, if it were to reach that sort of a level, would involve a tremendous amount of the population. And one can only imagine, we're not trying to bring up science fiction ideas here for movies, and we've seen them all before, but one can only imagine the sort of panic that might entail with the general population, and that has to face law enforcement with a real challenge.
Well, I think here, Ed, the key is educating the general public, letting the public know what the real concerns are. How do you get Ebola? How do you contract it? I think that is a key thing for the American public, because the reality is it has to be obtained. It's contagious only through the contact with saliva, contact with blood, diarrhea, vomit, or some other physical contact like that. The chances of the everyday American public getting it are pretty slim. I had to deal with the anthrax aftermath in New York City after 9/11, and it was, it was a problem. But it's nothing we can't deal with. It's nothing that law enforcement can't deal with. And in a city like New York, you have enormous resources that most other cities don't have. So it's a little bit easier in a bigger city like New York City.
30 seconds here, and then we'll take a break. What would you imagine is being done for the people at airports right now? Law enforcement standing there and waiting and watching. How alert are they, and what are they looking for now?
Well, I think they're extremely alert. And I think the big thing right now is the protocols from the point of contact with someone that's coming into this country that may have had contact with patients, infected with Ebola. I think the protocols, how we deal with those people, to make sure they're dealt with integrity and humanity and you know, they're taken care of. I think that's really important. You know, these people are sort of doing God's work. They have to be taken care of, but we also have to look out for the general public's health concerns.
All right, next up with Bernie Kerik, the danger of the lone wolf grows every day. What are we learning that can be used to make us safer from such attacks? It's on MidPoint.